comments as we have more information.
Kentucky State Representative, and you're joining me today on State Live Stream.
Because every single day, my administration is working to make life more affordable for Louisville families, to help families access health care, making child care and early learning more affordable, helping families buy their first home, and helping people put food on their table. Right now, we know that families are experiencing higher costs than ever before. We all see it when we fill up our gas tank, when you pay rent. You certainly see it when you walk into a grocery store. The cost of food is higher than it's ever been, and families are having to make difficult decisions every day, stretching paychecks further and further just to cover the basics to feed their family. At the same time, policymakers far from here in Louisville are making the daily lives of Louisvillians even more challenging. Just a few weeks ago, we were talking about how more than 50,000 adults in Jefferson County, more than 10,000 children have lost their health care coverage due to Medicaid changes out of Washington, D.C. And now, following additional federal changes last year, more than 10,000 people across Jefferson County no longer have S.N.A.P benefits, including 3,000 kids. Think about what this means as our kids are going back to school. Our kids should be worried about doing their homework each night. They should be thinking about finding their classroom, meeting their classmates, trying out for new sports teams, and making new friends. What they should not be worried about is whether there's going to be food on the table when they get home. They should not be sitting in our classrooms hungry. That's not acceptable in Louisville, Kentucky. And so as long as I'm mayor, we will always work to do our part. When federal funding cuts threatened meals for hundreds of seniors last year, here at Metro government, we stepped up and did our part. And we kept meals going, delivering to 1,800 seniors served by our senior nutrition program last year. Our staff at the Office of Social Services work hard every day to help older adults in our community live safely, independently, and with dignity in their own homes. Even going the extra mile for one client who was blind, preparing special letters and help heating instructions with each individual delivery for that individual. I'm proud that when seniors, children, and vulnerable families face challenges beyond their control, the public servants here in Louisville Metro government, we do everything we can to help. And that's also why we've continued year after year to invest in important, impactful organizations that are on the front lines every day, like Dare to Care. Dare to Care, along with other organizations across the community, like community ministries and others, step up to help families who are struggling to keep food on their tables. And they're doing extraordinary work. But as Vincent will tell you in a minute, organizations like Dare to Care cannot fill this gap alone. Think about this. For the cost of one meal that Dare to Care can provide, the S.N.A.P program can provide 9 meals. And that's why restoring S.N.A.P is so important. That's why protecting these benefits matters so much. That's why today we're speaking up. Recently, I joined more than 200 mayors from across the country in signing a letter urging the federal government to reverse these harmful and historic cuts to S.N.A.P by fully funding the program and protecting S.N.A.P benefits and eligibility. We want to be very clear. Here in Louisville, we'll continue doing everything that we can here at home. We'll keep supporting children. We'll keep supporting seniors. We'll keep supporting families, and we'll keep supporting organizations like Dare to Care. We will continue to look for every way possible that we can make life more affordable for Louisville families. But when it comes to hunger, this cannot solely rest on cities, food banks, and nonprofits. At a time when there is more demand than ever before for the services that Dare to Care provides, the federal government must restore SNAP and ensure that no child, no senior, and no family falls through the crack. We need the investment from our federal government. Here in Louisville, we believe that everyone deserves access to healthy food. And when our neighbors step up, when our neighbors need help, we step up and work together. We will continue to do that in every way possible. Now, I want to turn it over to a great local partner who is working hard every day with his team to help feed Louisville families who are in need. They are working incredibly hard, but again, they need the help of the federal government. Please join me in welcoming the President and CEO of Dare to Care, Vincent James.
Thank you, Mayor Greenberg, and thank you for your leadership. Thank you for recognizing the critical role that food banks and community partners play together to be able to make a difference in our community. Today's conversation isn't just about policy. When we think about the impact that it's having, it's really about our neighbors. It's about the very folks that we serve every day. We get an opportunity to be able to serve. Every day, our team is really talking to families, trying to help them to navigate and understand what is really happening. And as we're talking with them, we're seeing in terms of the impact on families and the impact what it's having in their lives every day. Every day, our team, as they're talking with families, who are doing everything they can and everything they're supposed to do. They are working. We're seeing families that are raising their children, caring for aging parents, and living on fixed incomes. They're making impossible choices between groceries and medicine and food and gas and childcare. These are impossible choices that families shouldn't have to make. These are stories that we're hearing every day, like Mr. Neighbors, an Army veteran who has served his country well, but yet still struggled to be able to put food on the table. The common thread is simple. People are working hard. They're working hard every day, but they're still falling behind. The cost of groceries continue to rise, and as we're seeing the rising cost of groceries and household budgets still being stretched every day, families aren't asking for luxury. They're asking for the basics, to afford the very basics to be able to have food. Food banks exist to respond to moments of crisis. We were never intended and never designed to be able to replace programs like SNAP. SNAP is one of the most effective tools that we know and recognize to fight hunger because it literally helps families to purchase food they need every month. And increasingly, we're hearing from our neighbors who are telling us that it's really not even, it's more challenging to fill out the application than the actual resources that you're receiving. They're sharing with us because they're receiving, as a result of the reductions, $20 and $30 and $50 a month. After filling out an application that would take an hour to 2 hours even actually put all the paperwork together. Families are really struggling to be able to say, listen, we understand that every dollar helps, but families are telling us that those benefits are simply not at the level, keeping up with the levels of cost of inflation in groceries, and we see the impact on families every day. And what is happening, and that's why it's really important that we strengthen SNAP. It's more important to strengthen SNAP because it's essential. It's not just important, it's essential that we do this. This is essential for our families, ensuring that they consistently can have food on the table. At Dare to Care, we're going to continue to do everything we've always done to continue to be able to support our families in our community. We will continue showing up for our families. We will continue partnering with more than 300 food pantries and shelters and schools and community to continue to have the impact that we've been having, but we can't do it alone. We will continue to find new ways to impact families in ways that we haven't done before, but we can't do it alone. We're going to continue to do all the things we've done, but again, I want to repeat, we can't do it alone. It's going to take our entire community. It's going to take a multi-sector approach. And that's why we're so thankful and appreciative of our mayor and the leadership that he's providing for our community to be able to help families who are really struggling. I don't know if you've experienced it, but waking up in the morning and you have children that are asking, what are we going to eat today? And you as a parent have to look at that child in the face and say, I don't know what we're going to have. That's the most devastating feeling for any parent to have. But yet, there are parents in Louisville, Kentucky that are experiencing that every day. And we want to help put an end to that. And that's when it comes to us working together. We're going to continue to find new ways to reach families with nutritious food. We're going to continue to support our community. But charitable food assistance works best when it's paired with strong public investment. We need the public investment to continue to do the things we've been doing for the past 50 plus years. We can't do it alone. As I say it again, you're going to hear this theme. It takes all of us. Hunger is solvable when our communities work together. And that's what it's going to take. And I want to thank everyone for taking the time to stand up. I want to thank our mayor. I want to thank his team for standing up and saying, we're not going to see anyone hungry in our community. And I want to encourage the community to continue to invest in solutions that strengthens families and reduce hunger. It's critical that we respond today because tomorrow may be too late. As a matter of fact, if you were to ask a parent today, when do they need help? They would say, I needed help yesterday because of the impact that is happening with their family. Kids are going back to school. No way should a child go back to school and have to struggle to understand where they're going to get their next meal. But the reality is, it's happening in our community every day. And so that's why we're here to ring the bell, ring the alarm. Louisville has always been a community that has stood up and rose to the occasion when challenges hit our community. And together we can truly make a difference. Together we can make sure that every child, together we can make sure that every family, every senior has access to nutritious and healthy food where they can not just survive, but they can thrive. So again, I want to thank our mayor, his leadership, other mayors across the country that are recognizing the need and the importance of being able to support families through SNAP benefits, as well as being able to support families through food banks that in turn supply the food to food pantries that get the food actually to our neighbors. And so we're encouraged by what we see in spite of the challenges that we face. The fact of the matter is that we're working together. And because we're working together, we can solve this. Thank you, Mayor, and thank you for being here today.
Thanks, Vincent. Thank you so much, Vincent. As Vincent just eloquently stated, we can't do this alone, but we are here to help our neighbors as best we can. And there are 8 neighborhood places that Louisville Metro government provides across Louisville that connect people in need with services, help them access the SNAP benefit and fill out those complicated forms that Vincent just talked about. They need health care coverage, rent and utility assistance, meal service, child care center, or more. We want to encourage people in need to please reach out to one of these neighborhood places, again, 8 across the city that we provide through Louisville Metro government. We will continue to work in partnership with Dare to Care and other organizations across the community. Our hope is that the federal government steps up as well to restore SNAP benefits to where they were so that families can get that important, needed support for their family, and that Dare to Care can continue to do its work in times of crisis. Unfortunately, every day is a crisis right now for far too many families, and that's where we need the federal government to restore these SNAP benefits. We'll keep working hard and keep trying our best, and our hope is that Washington does too. Thank you all very much, and Vincent and I are happy to take any questions if you all have them about this. Addie.
Vincent, can you talk about just how much the federal government has cut back? Can you talk about how much you guys are getting now?
The question was about the federal cuts.
With the federal cuts that we've seen thus far, we are about 3 million pounds down from federal commodities that we normally would have received. And so this impact in terms at an alarming time, because at the same time we're seeing federal cuts, we're also seeing an increase in demand. We just released last week a 62% increase over the past 2 years that we're seeing in terms of demand. So when you have supply that's decreasing and demand increasing, it's a perfect storm for what we're seeing today, which we are in a crisis. And what the mayor just had mentioned, we're in a crisis every day, unfortunately. It's been a food shortage, unfortunately. When you talk about the reduction in food that's been coming in, that's less food happening that's able to go out to our families. And so what we're seeing in terms of what our partners are sharing with us that they're running out of food. And it's not because we have food that is just stored up at our warehouse. It's because we don't have the food to be able to contribute. So Dare to Care is actually having to purchase more food than we've ever purchased in our past history. But again, we cannot make up what the government does. We have to have our government to stand up, our federal government to stand up, to be able to say we do not want to see families having to struggle like this. We know that it's possible. We've seen what happened during COVID. Families were being supported with all kinds of supports, and families were able to survive through COVID. When those supports decreased and were eliminated, and then you had the inflation of gas prices and grocery prices. Again, this is what we're seeing now and why this demand is so high now, because we know what the federal government can do with those supports and how they can help families. But when they're removed, we also see what happens with families having to wake up to make that decision. Do I put gas in my car? Do I provide medicine for my family, or do I provide food? And so these are impossible choices that families are having to make every day. We've heard this in terms of, unfortunately, that some of our partners have had to share with families that we've ran out of food. And again, it grieves me to even have to even say that, but that's the reality. I don't want to sugarcoat or hide anything from what is really happening from our families every day. I think it's a disservice when we overlook what people are having to deal with on a daily basis. These are tough choices that our partners are having to make. There's tough choices that Dare to Care is having to make. And the only way that we can truly make up the difference is through the federal government support and our community support. We need the corporate support. We need the local government, which Mayor has been phenomenal in supporting Dare to Care and the work that we're doing. So we say thank you, and we are encouraged by what we see, but we also are discouraged by the fact that the government has made a decision to be able to support families.
Mayor, is there any additional resources that the city is giving the folks in these situations, or is there more from the city to places like Dare to Care right now?
Well, the question was about the city resources. So in our last budget, we just provided, again, funding for organizations like Dare to Care and Association of Community Ministries, as well as money towards Dare to Care's large long-term project, which is going to be a whole new distribution and warehouse system in West Louisville that will serve our community. That's a longer-term strategy. We're trying to address this short-term need while also supporting their long-term goals that we collectively foresee out into the community. So, right now, we're going to continue to look for ways that we can. We funded the budget for this year. We do have, that's why I talk about our great team. We have a team of people that are there to help others, to provide support services, to help them get signed up for all the federal or state programs that are available. That is, we will continue to do that every day. We need the federal government to step up with these SNAP benefits to really provide that relief that families need, and that an organization like Dare to Care, a local government like Louisville Metro government, just can't do on our own. Thank you all very much.
Thank you. Yes, appreciate it. Take care.
Why is everybody why
Hey
is
y'all,
the
I'm
police
Attica
fighting
Scott,
against
former
us?
Kentucky State Representative, and you're joining me today on State Live Streams.
We will continue to provide updates as we have more information.
Former Kentucky State Representative, and you're joining me today on State Live Streams.